So now, many facilities hire workers with specialized skills and build teams to care for patients, with each team member meeting a specific patient need. In the past, doctors examined patients, diagnosed illnesses, and planned treatments, while nurses did most of the other patient care tasks. Today, many healthcare workers share lots of those other duties. Specially trained technicians perform medical tasks such as EKGs or sonograms. Medical assistants record patients' medical histories and measure vital signs, among other tasks. Nursing assistants provide routine medical care such as feeding and bathing, can also measure vital signs and report their observations of patient conditions. Phlebotomy technicians are part of this trend towards hiring specialized healthcare workers. The good news is the Department of Labor forecasts about a 23% growth in the hiring of phlebotomy technicians over the next several years. Average growth for other job categories is about 7%. So it's a fast growing field. Healthcare workers of all kinds will likely continue to be in high demand. People will always need to receive health care, and populations in particular needed care, such as the elderly, are growing and growing and growing. Phlebotomists may have the opportunity to work in many of these healthcare facilities, such as physician's office, reference laboratories, urgent cares, nursing homes, wellness, and clinics. Long-term facilities are businesses that provide skilled care 24 hours a day to residents who live in the facilities. These facilities may offer assisted living housing, dementia care, or subacute care, which is important for patients who require more than can be provided in the home, but do not need to be in a hospital. Some facilities offer specialized care, while others care for all types of residents. The typical long-term care facility offers personal care for all residents and focused care for residents with special needs. Phlebotomy technicians with some other types of healthcare workers often visit long-term facilities so residents do not have to leave to receive care. Your clinical laboratories, which may also be called medical laboratories or diagnostic laboratories, are both key to inpatient and outpatient healthcare. These laboratories collect and analyze specimens from patients in order to provide doctors and other healthcare professionals with information. This information may be used for routine screening, as in an annual wellness exam, may also be used to help diagnose an illness or to gather more information about a problem the patient is experiencing. They can be located either in a hospital or other healthcare facility or at a separate facility. Some doctors' offices, especially urgent care offices, have their own limited laboratory facilities and refer patients for larger labs for certain tests. Each clinical laboratory is different, but they have some things in common. All laboratories collect and analyze specimens or samples from patients. Common specimens can include blood, urine, stool, feces, and sputum, which is mucus coughed up from the lungs. They can also include body cells, such as a swab collecting cells from inside of a cheek or tissues, as in biopsy that removes tissue to examine it for signs of disease. Not all specimens are analyzed at the same laboratory where they're collected. Reference laboratories do not collect specimens, but analyze specimens collected in another place. These laboratories may be far away from the laboratory or doctor's office where the specimen was collected. Laboratories in the United States must meet standards listed in a set of regulation called the Clinical Laboratory Improvement Amendments, or what was commonly referred to as CLIA. That's going to be a common term that's going to come up in this course. These include educational requirements for certain laboratory employees, as well as rules for handling patient specimens and tests, and quality assurance and control practices. The goal of CLIA is to make sure patients receive the best quality care and that their laboratory tests are performed safely and accurately by qualified personnel. Although they're not legally to do so, laboratories should also be accredited or officially approved. So as said before, laboratories have special departments for the analysis of different types of specimens. There are many different types of specimens collected by the phlebotomist and many different types of departments which analyze these specimens. Just a few of the more common specimens would be hematology, blood bank diseases and coagulation, or the process of blood clotting, all studied in this department. The number and types of blood spells and specimens and details about the composition of blood, such as the capacity to carry oxygen, parts of hematology. Coagulation refers to the ability of blood to clot and coagulate, so as a person doesn't bleed to death during mild or major trauma. The chemistry is a department that works to analyze blood and other specimens for the presence of particular chemicals. Cholesterol, glucose, and hormone levels are examples of analysis done in the chemistry departments. The toxicology department looks for certain types of poisons within the circulatory system and how much of each poison is present. Immunology, in this department, blood and other body fluids are tested for different factors such as antibodies that affect the body's response to disease. Antibodies are part of the body's response to foreign materials like viruses and bacteria. These tests can help to monitor a patient's response to cancer treatments, for instance, or in managing the body's response to an organ transplant. Allergy testing is also part of immunology. Blood bank, otherwise known as transfusion medicine, or immunohematology. These operations focus on collecting and preparing blood for transfusion. Blood typing and analysis for donor-recipient compatibility are performed in this department, and blood products are prepared for transfusion. Histocompatibility testing is the ability to test how one tissue would react with another tissue, such as in the example of organ donation or grafts. Microbiology is the area of the laboratory. Scientists study microorganisms or living things so small they can only be seen under a microscope. Bacteria and viruses are types of microorganisms, and they can sometimes cause disease. Blood and other specimens can be cultured, which means that any microorganisms present are caused to multiply. In this way, the microbiologist can analyze microorganisms in the patient's specimen. This helps the doctor diagnose illness and plan the best treatment. In the case of a bacterial infection, culturing the blood can help the doctor understand which antibiotics might be most successful in fighting the type of bacteria present. Some other departments that are not listed on the slide include pathology, which is the study of the causes and effects of disease. This department studies body tissues and other specimens to determine the presence or progress of disease. Cytology is a department that specializes in the examination and the structure and function of cells. In the clinical laboratory, cells are studied for signs of disease. Urinalysis is important. This department performs various tests on urine, including visual inspection, microscopic inspection, and chemical testing. Urine may be tested to diagnose illnesses or as a part of the management of various illnesses or conditions. This chart, while does not necessarily have to be committed to memory, shows the line of authority from the director to the medical technicians and the phlebotomists. If we start all the way at the top, you see that the laboratory director is responsible for the overall administration of the laboratory, including compliance with all applicable regulations, those handed down from Joint Commission as well as CLIA. Usually a physician or a PhD scientist specializes in pathology. And then down the rungs of the chain, you have the laboratory manager, who's responsible for day-to-day operations of the laboratory. She may also be a physician or a PhD scientist, or may possess a lesser degree and relevant experience. Technical consultants are responsible for the technical aspects of testing in the laboratory. There may be multiple technical consultants for various departments of a lab. In other words, chemistry, microbiology, may be a physician or PhD scientist, or may possess a lesser degree and relevant experience. Then our clinical consultants, responsible for the clinical aspects of testing, including consulting with the laboratory's clients regarding patients' diagnosis, treatment, and management. You must either be qualified as a lab director or must be a licensed physician. And down at the bottom of the rungs, you have your testing personnel, which include medical technologists. These people are responsible for performing ordered tests on patient specimens. Educations may vary considerably, but the minimum requirement is a high school diploma and documented training in analysis of patient specimens. And then here you have the phlebotomy technician, who is responsible for collecting patient specimens. Requirements vary, but generally must have a high school diploma and documented training and/or experience. Certification is usually required, and later in this course we'll talk about the benefits of certification and accreditation and how it may very well benefit you in the process of finding employment as a phlebotomy technician. So every patient at a healthcare facility has different needs and problems. Healthcare professionals with a wide range of education and experience will help care for the team. As mentioned before, it is a team approach. These people are considered the healthcare team, and together they provide all the different types of care a patient might need. There are several members of the healthcare team, including the most important member themselves is the patient. The patient is an important team member. It is the most important team member because this is the reason why you have the job to begin with, and is actually the reason for why the team exists. Providing quality care means placing the patient's well-being first and giving him or her the right to make decisions and choices about their own care. Certified healthcare workers include phlebotomy technicians, EKG technicians, patient care technicians, are examples of team members who are trained to perform specific tasks. They do jobs like drawing blood, conducting tests, or measuring vital signs to gather information doctors need to care for the patient. They must have high school diplomas as well as additional education, training, and certification to perform their job duties. A licensed practical nurse or licensed vocational nurse administers medications and gives treatments. An LPN or LVN is a licensed professional who has completed 1 to 2 years of education and has passed a national licensure examination. Licensure is a legally required process that must be completed to practice a medical profession in any state. This differs a little bit from a registered nurse or RN. In a hospital, long-term facility, or clinic, a registered nurse coordinates, manages, and provides skilled nursing care. This includes administering specialized treatments, giving medications as prescribed by a physician, In a hospital, a registered nurse also assigns tasks and supervises daily care of patients by nursing assistants or patient care technicians. An RN, registered nurse, is a licensed professional who has graduated from a 2 to 4 year nursing program. RNs have diplomas or college degrees and have passed national licensure examinations. They may also have additional academic degrees or educations in specialty areas. You have therapists. Hospitals and other healthcare facilities employ a wide variety of therapists who help meet patients' needs. Speech language pathologists, physical therapists, and respiratory therapists are a few examples. All of these team members have different education and clinical experience education requirements for their jobs. Most physical therapists have doctoral degrees. Speech language pathologists must have master's degrees, and respiratory therapists must have an associate's or bachelor's degree. All must meet state licensure requirements. A registered dietitian assesses a patient's nutritional status and creates diets to meet patients' special needs. They may also supervise the preparation of food and educate people about nutrition. Registered dietitians have completed bachelor's degrees and may also have completed postgraduate work. Most states require that registered dietitians be licensed or certified. You have your pharmacist and pharmacy technicians. A facility's pharmacy department maintains supplies of medication and ensures that patients receive the medications they need. Pharmacists must have doctoral degrees and are licensed to practice. Pharmacy technicians who assist with measuring, packaging, and labeling medications generally have a high school education and specialized training and certification. Nurse practitioners and physician assistants are considered mid-level practitioners. These members of the healthcare team can perform many duties, usually associated with doctors. In addition to the responsibility common for RNs, nurse practitioners and physician assistants can examine patients, diagnose, and can prescribe medications. They can also order various diagnostic tests. States have differing rules about the tasks these practitioners can perform and the level of doctor supervision that they're required to have. NPs and PAs have usually master's or doctoral levels and several years of experience in the healthcare field. They too must also be licensed. Physicians or doctor, whether it be a medical doctor or doctor of osteopathy, the doctor diagnoses disease, disability, and prescribes treatment. Doctors have graduated from 4 year medical schools, which they attend after receiving a bachelor's degree. Many doctors also attend specialized training programs after medical school. Doctors must be licensed to practice medicine and may also be certified in one or more specialties, such as respiratory, surgery, emergency medicine, and so on. Healthcare workers, like phlebotomists, carry out instructions given to them by their supervisors. The supervisor acts on the instructions of a physician, laboratory director, or other member of the care team. This is called the chain of command. It describes the line of authority at a facility and helps to make sure the patient gets proper health care. The chain of command also protects employees and employers from liability. We'll talk more about liability later on, but liability is a legal term that means someone can be held responsible for harming someone. For example, if a patient has a seizure during a blood draw and is injured, there may be a question of whether the phlebotomist is responsible for the injury. If the blood draw was ordered by the patient's physician, performed according to policy and procedure, and the phlebotomist responded to the patient's seizure appropriately, the phlebotomist is unlikely to be found liable. This is why it's important for team members to follow procedures carefully and for the facility to have a chain of command. All healthcare workers must understand what they can and cannot do. This is important so they do not harm patients or involve themselves or their employees in lawsuits. Certified healthcare workers like phlebotomy technicians are not licensed healthcare providers. Everything they do in their job is assigned to them by a licensed healthcare professional and must fall within what's called their scope of practice. A scope of practice defines the tasks that healthcare workers are allowed to perform according to state or federal law or facility policy. Laws and regulations vary from state to state. It's very important that healthcare workers follow their facility's policy regarding scope of practice. The term standard of care is different than scope of practice in that it refers to the level of quality or expectations that the medical practitioner, such as the phlebotomy technician, meets. To make it very simple, scope of practice refers to what the phlebotomy technician is allowed to do. Standard of care refers to how well they do it. Do they meet all points of quality? Do they take all extra steps to make sure that the specimen is obtained completely and accurately, um, and so on. The term certification and licensure may be somewhat confusing for the phlebotomy technician. Certification simply means that the phlebotomist or the phlebotomy technician has completed a course of training and has set goals and passed certain expectations put forth by that accrediting agency. The accrediting agency itself has no legal representation within the government. Licensure, uh, the term licensure refers to the fact that that medical professional has been acknowledged by local government, such as the city or more likely the state, to have completed successfully and have met all requirements to engage in that particular profession. It often requires background checks, applications, and fees, and is usually good for a certain amount of years. A person's license is also, I should say, a medical professional's license is also a matter of public record and can be looked upon by lawyers investigating a potential lawsuit. Making sure that the blood test that the phlebotomy technician draws is of the highest quality involves several tasks. The phlebotomy technician should be expected to work professionally with all patients, some of whom might be anxious about needles or blood or fearful about a possible diagnosis. They should be good at creating a calming atmosphere, ensuring accurate patient identification, which is one of the most important tasks a phlebotomist can do. Again, I'll repeat it again, ensuring accurate patient identification. Please remember that. Carefully explaining the specimen collection procedure, answering patient questions about the procedure as appropriate, referring questions about results or diagnosis to the patient's doctor, closely following the correct collection procedures of each type of test, observing infection prevention precautions and procedure, and very importantly, protecting the patient's confidential health information, keeping the patient safe during the collection process, and correctly labeling and transporting specimens. The scope of practice for phlebotomy technicians may vary from facility to facility. Usually it's limited to the collection of blood specimens through venipuncture and capillary or dermal puncture. In some cases, phlebotomists may also collect non-blood specimens such as urine, stool, or cells from the cheek or throat. They may perform some very simple tests on blood or non-blood specimens. Phlebotomists should never diagnose why a doctor has ordered a test or what a diagnosis might be associated with particular results. For these questions, the patient should be referred to the person who ordered the tests. Phlebotomists should not offer opinions about a patient's health and should refer any questions or concerns to the doctor. In some facilities, technicians are trained in broader skills such as taking patients' medical history or measuring vital signs. These duties should only be performed if the phlebotomist is trained and authorized to perform them. Tasks that are usually considered to be outside the scope of practice for a phlebotomy technician include the following: providing test results. These should be discussed by the doctor. Discussing or interpreting results, telling them what kind of diagnosis this may lead to. Offering any type of medical advice of any kind, including even the provider's recommendations, is outside of the phlebotomist's scope of practice and is a no-no. Performing tests on specimens other than certain simple tests is ordered and as allowed by the facility. More on this topic later. Generally, phlebotomists are not allowed to draw blood from arteries or perform arterial blood gas tests unless they have received specialized training. Phlebotomy technicians should never draw blood from an indwelling port or intravenous line. An intravenous line is a direct access from a tubing into the patient's vein to administer fluids and medications. Generally, phlebotomists are not allowed to inject medications or insert or remove intravenous lines as well. Okay, so become familiar with the term policies and procedures. All facilities have policies and procedures developed specifically for their organizations. A policy is a course of action that should be taken every time a certain situation occurs. For example, a very basic policy is that healthcare information must remain confidential. I'll talk more about that later. A procedure is a method or way of doing something. For example, a facility will have a procedure for reporting any incidents that occur with patients, like patient fainting during a blood draw. The procedure explains how to respond, what form to complete to document the incident, when to fill it out, and to whom it is given. Employers will have policies and procedures for every patient care situation. New employees will be told where to find a list of policies and procedures for all staff that are expected to follow. These have been developed to give quality care and protect patient safety. Procedures may seem long and complicated, but each step is important. Phlebotomists must become familiar with always follow policies and procedures. Common policies at hospitals and clinical laboratories include the following. Patient information must remain confidential. This is going to be a recurring theme in almost every class that you take. This is not only a facility rule, it's also mandated by law. More information about confidentiality, including HIPAA, will be found later on in Chapter 2. The requisition or testing order form must always be followed. Phlebotomy technicians only collect specimens assigned through the requisition form. Collection of specimens for tests that are not listed or approved by the practitioner who completed the requisition should not be performed. Healthcare workers should not do tasks that are included Healthcare workers should not do tasks that are not included in their job description. In other words, stay within the scope of practice. Healthcare workers must report important events or problems with patients to a supervisor above that chain of command. All employees must be on time for work and must be dependable. This goes hand in hand with the term professionalism, with which we're going to be talking about shortly. Quality assurance and quality improvement are both important ideas in healthcare settings. Quality assurance practices make sure care is being provided according to facility policy and procedures, with results that meet expectations. Quality control measures the part of quality assurance. They are processes put in place to document that standards are being met. Quality improvement practices seek to make sure better in a way that can be measured. There are many ways in which facilities put quality assurance and quality improvement practices into action. Continuous quality improvement is a goal of all healthcare providers. Organizations like the Joint Commission conduct regular surveys or inspections of hospitals, laboratories, and other healthcare facilities. These are quality assurance reviews designed to measure a facility's success in providing safe and effective care. Although participation in these surveys is not required, facilities that receive federal money for care must meet specific quality standards. Joint Commission surveys are one way to prove the facility meets these standards. The Clinical and Laboratory Safety Institute, or CLSI, is a nonprofit organization that works with government agencies and healthcare providers and institutions to develop standards of practice for laboratories worldwide. Although CLSI does not perform reviews or accredit laboratories, following CLSI standards is an important part of providing quality care. Different states have different requirements for quality assurance and improvements in healthcare facilities. Each facility may have its own policy and procedures regarding quality assurance and improvement. In 2011, the U.S. Department of Health and Human Services established the National Strategy for Quality Improvement in Healthcare, also called the National Quality Strategy. The National Quality Strategy has three aims. 1. Better care. Improve the overall quality of care by making healthcare more patient-centered, reliable, accessible, and safe. 2. Healthy people, healthy communities. Improve outcomes by addressing behavioral, social, and environmental factors related to health. And then 3. Affordable care. Reduce the costs of quality health care for individuals, families, employers, and government. Healthcare workers at hospitals, laboratories, and other facilities are trained in these practices. Their facilities have adopted to meet these goals and achieve continuous quality improvement. I'd like you to maybe take a few moments to think about some of the ways you, as the phlebotomist, can deliver the highest quality care to your patient. If anybody has some suggestions, they want to put it on the discussion board or bring it to class, I highly encourage you to do so. As mentioned before, many healthcare workers are required to have a certificate or license in the state where they practice. Certification is a process used in healthcare to ensure skills are mastered for particular positions. A school or organization offers a training program designed to enable students to meet certain standards in that healthcare field. The school, organization, or state government agency may maintain a registry that can be checked by potential employers to verify certification. Nursing assistants, patient care technicians, and phlebotomists are examples of healthcare workers who may need to be certified. Laws addressing certification for these positions are different from one state to another. There are no national laws addressing phlebotomy certification, but some states require it. Many facilities require certification, and having it is definitely an advantage when looking for a job. In the program that you're taking here at Queensborough, we affiliate ourselves with the National Healthcare Association, which is an accrediting agency that you will be familiar with upon completion of these courses. Several organizations certify phlebotomy technicians. Some of the most widely recognized ones are the American Society for Clinical Pathology, National Center for Competency Testing, and National Healthcare Career Association, exactly what I just spoke about. Before taking a certification test, students must complete a recognized training course and must already have clinical experience working as a phlebotomy technician. Phlebotomy technicians should also have an amount of clinical experience, and the phlebotomy programs should be able to facilitate this to give students hand-on practice with patients. Clinicals, as this training is sometimes called, may be arranged by the instructor and take place under the supervision of healthcare professionals. It's not possible to do clinicals at a healthcare facility. The instructor may set up a lab area for volunteers to have phlebotomy procedures performed. That will not happen at Queensborough. Certification agencies require that students perform a set number of venipunctures and capillary punctures before receiving certification. The number varies widely from one agency to another. For our purposes, the National Healthcare Career Association requires 30 documented venipunctures and 10 documented capillary punctures. Once a phlebotomy technician is certified, he or she will need to maintain her certification. Most certificates must be renewed every few years and require proof of ongoing work in the field, as well as a set number of hours of what's called continuing education. Continuing education, also called in-service education, keeps healthcare workers up to date on changes in medicine that affect their job. It may also address new equipment, new procedures, or an employer's policy changes. The phlebotomy technician is responsible for meeting deadlines and fulfilling these requirements for certification. And just to recap these points about certification, remember, phlebotomy technicians, along with healthcare workers like nursing assistants and patient care technicians, are certified, not necessarily licensed, especially in New York State. There's no federal law requiring phlebotomy technicians to be certified. So some agencies will hire medical assistants with no phlebotomy technician certification. Sometimes they'll hire medical scribes and train them in-house to draw blood. However, that's generally frowned upon and can set the agency up for a lawsuit if something goes wrong. Some states do require phlebotomy technician certification, but many employers require certification because they want to limit their liability. And usually certification allows the technician to find work more easily and receive better pay because the potential employer is going to see that certification on the resume and think that this candidate has better attributes than their competition. So becoming and staying certified usually requires several steps. First, you need to complete a recognized training course. As I said, some agencies may waive this for applicants who have phlebotomy experience or are trained on the job, such as paramedics, LPNs, such as that sort. But in general, for our purposes, we need to complete our training course. It starts with this course of phlebotomy technician, and hopefully you'll finish up to complete your medical assistant degree. Performing the phlebotomy procedures and clinical experience is required by the certifying agency. As I said before, NHA, whom we are affiliated with, wants 30 documented live blood draws, venous blood draws, and 30 documented live capillary punctures. Then you're going to need to register for and pass a certification exam, which we have many means of getting you prepared for. Renew your certificate as required by the agency, generally every 2 years. And for certification renewal, provide proof of work in the field and completion of continuing education. That's usually not a problem. That can be verified by any employer or agency that you work for. Now we'd like to talk about the term professionalism and what does it mean to you? Well, professional means having to do with work or a job, but it doesn't just refer to receiving a paycheck for services rendered. Personal refers to life outside of a job. Professionalism is behaving properly when on the job. It includes dressing appropriately, speaking well. It also includes being on time, completing tasks, reporting to supervisors as needed. For a phlebotomy technician, professionalism means performing assigned duties carefully and efficiently, interacting appropriately with patients and coworkers, and ensuring that specimens collected are of the highest possible quality. Following policies and procedures is an important part of professionalism. Patients, coworkers, and supervisors respect employees who behave professionally. Professionalism helps people keep their jobs and may also help them earn promotions and raises. It also, most importantly, helps keep the potential patient at ease. And I said, very important for keeping the patient at ease. A patient who is calm, collected, comfortable with the phlebotomist's professionalism is more likely to be compliant and cooperative during the blood draw itself. Again, professional behavior communicates respect and earns respect in return. It helps ensure continued employment and may help lead to promotion opportunities and raises. Now, these are some examples, not all examples, of professional interactions with patients, which include the following as far as professional behavior goes. Providing care appropriate to each patient, for example, adjusting communication as needed based on the age or condition of the patient. This will be discussed later when we talk about communications. Performing only assigned tasks and not discussing information that is beyond the phlebotomy technician's scope of practice. Keeping all patient information confidential. Again, that will be a recurring theme. Always being polite and keeping a positive attitude. Not discussing personal subjects with the patients. It's about the patient. It's not about you. Not discussing possibly controversial subjects like politics or religion with patients. That is always a recipe for disaster. Not using personal phones in patient care areas. Patients and customers in other fields tend to look down upon that practice. Just think about your own interactions. Not using profanity, even if the patient does. As a professional, you need to hold yourself up to higher standards. Listening to the patient's concerns and taking them seriously. Even if there's nothing that you can do about it personally, you can always listen with an empathetic ear and bring those concerns to a supervisor. Calling a patient Mr., Mrs., Miss, or Miss, or whatever preferred pronoun they prefer at this point in time, and his or her last name, or by the name he or she prefers. Terms such as sweetie, honey, and dearie are unprofessional, demeaning, derogatory, and offensive, and should not be used in a professional setting. Just think about if you had your mother or grandmother in a hospital and a 20-year-old phlebotomy technician starts referring to your grandmother as sweetie. Think about how that would make you feel. Always explaining the procedure before beginning, not just going in there and sticking a needle in someone's arm without them knowing why you're doing that. Using correct terms rather than slang. An example, saying, I'm going to perform your blood draw now, rather than saying, I'm just going to stick you. Always following proper infection control processes, such as hand washing, personal protective equipment, stuff that will be discussed more in detail later on in this course. What do potential employers expect of their phlebotomy technicians? Well, for one, always completing tasks efficiently, always following policies and procedures, even if you don't necessarily agree with them personally, documenting and reporting carefully and correctly. That'll be discussed more when we talk about quality assurance and quality improvement. Reporting problems with patients or tasks, reporting them above or at the proper level of chain of command and not just trying to take care of them on your own. Reporting anything that keeps a phlebotomy technician from completing their duties, such as patient non-cooperation to lack of supplies or malfunctioning supplies. Asking questions when needed. Take direction and feedback without becoming upset or taking it personal. It's called constructive criticism. Be clean and neatly dressed or groomed. Present yourself with a professional appearance. How you present yourself on the outside tells the patient a lot about how well you take your job. always being on time. Remember, when you're working in medicine, especially in an inpatient facility that runs 24 hours, if you don't come to work on time, it generally means that somebody else does not get to go home on time, and that can generally lead to some conflict and some uneasiness in the workplace. Um, Once in a while, people always have situations that are beyond their control, but a pattern of tardiness is, again, unprofessional and can cause trouble down the line. Communicating with the employer if unable to report for work. Don't just not show up regardless of the incident. Following the proper chain of command. Participate in education programs and being a positive role model for this facility, especially once you get some experience under your belt and your task is to be a role model for the newer professionals coming into the facility. The best phlebotomy technicians have different types of attributes. The type of attributes that most phlebotomy technicians, as well as any other medical professional involved, should include empathy, meaning identifying with the feelings of others. This is different than sympathy. People who are empathetic work to understand other people's problems. They care about them. Many people find needles in medical settings in general to be frightening. Patients may also be fearful about their possible diagnosis. Approaching a patient with empathy is part of a phlebotomist's job. Honesty. An honest person tells the truth and can be trusted. Patients need to feel that they can trust the people who care for them. Employers count on truthful records of the care provided. Tactful. Being tactful means showing sensitivity and having a sense of what is appropriate when dealing with others. It's the ability to speak and act without offending others. There's an important balance between honesty and tact. For example, a phlebotomy technician should not lie and tell a patient that a needle stick will not hurt. However, she should be tactful about the way she explains the feeling. Tact and empathy are also connected. Tact is required when a phlebotomist is taking care of a patient who is very, very anxious. Being conscientious. People who are conscientious try to do their best. They're guided by a sense of right or wrong. They're alert, observant, accurate, and responsible. Giving conscientious care means taking responsibility for one's actions during each patient interaction. Accuracy in performing procedures, care with infection prevention and safety, and appropriate interactions with patients are all aspects of providing conscientious care. Without it, patients' health can be endangered. Dependability is important for phlebotomy technicians, and they must be able to make and keep commitments. They must be able to perform the tasks assigned to them. They must be able to report to work on time, and they need to avoid absences and be reliable to their peers. Patient. People who are patient do not lose their tempers easily. They do not act irritated or complain when things are difficult. Patients may be anxious, sick, or in pain. They may be hesitant about having their blood drawn. It is important that technicians not rush patients or act annoyed. Respectful. Being respectful means valuing other people's individuality, including their age, religion, culture, feeling, practices, and beliefs. People who are respectful treat others politely and kindly. They avoid negative conversations and gossip. And finally, unprejudiced. Phlebotomy technicians work with people from many different backgrounds, including religious, cultural, socioeconomic. They must give each patient the same quality care regardless of age, gender, gender identity, sexual orientation, religion, race, ethnicity, or condition. Phlebotomy technicians, just like any medical professional, must learn to manage their time well. There are many tasks that must be done during their shifts, and each patient will require different tests and individual attention. Managing time properly helps phlebotomy technicians complete their tasks efficiently. Planning is the single best way to manage time better. Sometimes it's hard to find time to plan, but it's essential. Patients who need blood drawn are prioritized differently based on the tests ordered. Multiple tests are often needed, and there's a specific sequence required for filling the specimen tubes so that each test is as accurate as possible. More to be discussed later. Phlebotomy technicians must take time to check and make sure they have all the supplies needed for each patient. Supplies should be organized to make it easy to collect specimens in the correct order. Taking the time to organize and then recheck can improve focus, decrease stress, and prevent orders. Now, just as in any field, the phlebotomy technician is going to encounter stressful situations from time to time. Stress is a state of being overwhelmed by mental or emotional demands. It can cause a person to feel frightened, excited, confused, in danger, or just plain irritated. It's often thought that only bad things cause stress, but positive situations cause stress too. For example, graduating from school or getting a new job are usually positive situations. However, both can cause an enormous stress because of the changes they bring to a person's life. Learning how to recognize stress and what causes it is helpful. A stressor is something that causes stress. Any change or situation, possibly positive or negative, can be a stressor, including life changes like graduating or moving, feeling unprepared for a task, starting a new job, problems at work, losing a job, new responsibilities, conflict with peers or supervisors, challenging patients. These are just a few examples. What do you think may be some stressful situations you will encounter on the job? These are all food for thought. How would you plan to manage these stressors? What can some negative effects of poorly managed stress be on your physical and mental well-being? And what are some things you can do on your own time to manage stress? These are all things that should be thought up of and maybe brought to class if there's any questions. And that is it for this presentation. If there are any questions, please feel free to post them up on the discussion board. It can be anonymously if needed, or you may also bring these questions, and you're encouraged to bring any questions on this presentation to the upcoming class. And with that, we will look forward to seeing you during the week.